Thanks so much. So I'm going to ask now if everyone could mute, and so go ahead and do that. And I'd like to officially welcome you to our fall prevention presentation. And we'll introduce ourselves now.
Hi, everybody. Unmute myself. Hi, I'm Jim. I'm the physical therapy supervisor with Visiting Nurse and Hospice of Fairfield County. I work in patients' homes. I go to see people in their homes every day. So I'm very excited to talk to all of you tonight, along with Gus and Kathleen.
Kathleen, I think you're muted.
Am I better now?
Yep.
Okay, good. I'm Kathleen Tetley. I'm a registered nurse with Waveny. I started out as a cardiac nurse and came to work for Waveny about 9 years ago. Was out in the field as a home care nurse for many years, visiting the homes of lots of wonderful people all over Fairfield County. And now I am the care transition coordinator with the Waveny LifeCare network and Visiting Nurse and Hospice as well.
And my name is Gus Schlegel, and I'm an occupational therapist. I work for Waveny Life Network as a home care therapist. So I go into people's homes, just like Jim does. And I work with people there, and I enjoy it because I get to see really how people live. And I think I make we make a big impact there. So this fall presentation is fall prevention presentation made possible through the joint efforts of Visiting Nurse and Hospice of Fairfield County and the Waveny Life Care Network. This slide set was initially developed by two national organizations, the American Occupational Therapy Association and the American Physical Therapy Association, working together with the National Council on Aging. And we're talking about falls, and falls, it's a major cause of unintentional injury, and it can lead to moderate to severe injuries, such as hip fractures and head traumas, and can even increase the risk of early death. In March 2014, the Department of Public Health Commissioner unveiled the Healthy Connecticut 2020 State Health Improvement Plan and announced that fall prevention was one of the top 7 priorities for the DPH in the next 5 years. And so here's a slide of just some numbers. And if your screen is too small, I'm just gonna read these for you. In Connecticut, falls are the leading cause of injury-related death for Connecticut residents aged 65 years and over. So if you're over 65, there's a greater risk of you falling. And it's also the 4th leading cause of falls for all ages. Falls resulted in approximately 42,287 hospital discharges among Connecticut residents from 2007 through 2013. And from 2006 to 2010, the number of deaths due to falls in Connecticut was 1,579, so almost 1,600 people that died because of their fall. In addition to being the leading cause of hip fractures among older adults, falls are also the leading cause of traumatic brain injury and a leading cause of earlier admission to a nursing home. Costs for hospital inpatient discharge due to falls totaled over $1.1 billion from 2007 to 2013, not including the cost of long-term care or rehabilitation. So this is just acute care hospital. We're not talking about the rehab that they received after. And the total cost of emergency department encounters, you going to the emergency room because of the fall from 2007 to 2012, was $523 million. So a big question is, are falls preventable? Many of us want to know that. And the simple words, she fell or he fell, can have a huge impact on us. We all know someone who has had a fall and experienced significant life changes. So, Jim, tell me, are falls preventable?
That's a great question, Gus. And that's really why we're here tonight, to discuss, are falls preventable? And if so, how? And the answer is yes, falls are preventable. So we can all breathe a little sigh of relief there. We can prevent these. And that's what we're here to talk to you about tonight, is how can we prevent these falls? So what we're going to review tonight, we want to go over what just a general definition of a fall is. We're going to go over fear of falling, some risk factors for falling, and then some action steps that you can take yourself to reduce the risk of falling. So the first question really is, okay, well, what is a fall? And I think we all probably have an idea in our head what a fall might be. And I think initially what comes to mind is, let's say you're walking down the hallway and you slip, you trip, and you land on the ground. So yes, that would be a fall. But we have a little bit of a broader definition when we talk about falls. So really the truest sense what a fall is when you're landing on the ground or another lower surface when you didn't intend to be there. So that could be in that first example, you're standing up and then you slip and fall to the ground. So that's a fall. You unintentionally started on your feet and landed on the floor. But another example would be, maybe you start on your chair and you start to stand up and you lift yourself up and then you unintentionally tip backwards into the chair. That would technically be considered a fall. Or maybe sitting on the edge of your bed. You're sitting on the edge of your bed, middle of the night, you get up to use the restroom and you find out you slide down off the edge of the bed. So you started on a higher surface and you found yourself down on the floor. So there's a lot of different ways that you can technically have a fall and it still be considered a fall. And I even consider it a fall if you're walking down the hallway, and you lose your balance and you use the wall to catch yourself. You unintentionally lost your balance, and if the wall had not been there, you likely would have fallen a little bit further. So these include slips, trips. That's all considered a fall, and it doesn't necessarily have to be a medical event. And hopefully, if one does happen, it isn't a medical event. Hopefully, if you do have a slip or a trip and a fall, hopefully you're okay. But it can include a medical event.
So Jim, so let me understand correctly. And I'm going to tell you what happened to me the other day. I was carrying a clothes basket, and my kids leave toys all over. And I was carrying the basket, and I stepped on some Legos, and I fell over to the side, but the wall caught me. But I think if that wall hadn't have been there, I just would have kept going. Would you consider that a fall?
Yeah, that's a great question. You didn't fall to the floor, but you did lose your balance and the wall was there to catch you. I would consider that a fall. I would classify that as a fall. Yeah.
So I think that's one of the questions that we have to ask ourselves. I clearly had a fall, then that would be considered a fall. Have you had a fall in the past year? Were you hurt? Do you worry about falling now? Do you feel unsteady when you're standing or walking? As we go through the risk factors for falls, think about what might have been the cause of any recent falls that you had. I know for me, it was the Legos, and I lost my balance. When asked, because we talked about fear of falling in the last slide, when asked, are you afraid of falling? Many people say, well, no, I'm not afraid. I'm just more careful. A fear of falling is defined as a lasting concern about falling that may cause a person to stop doing activities she or he remains able to do. For instance, if a person stays in most of the winter because of concerns about slipping on the ice, then the ice and fear of falling is limiting their activities and social interaction. This fear of falling is in itself a risk factor of falls. And when we do a checklist, a fall risk factor checklist, there's a question: is there a fear of falling, or have there been falls in the past? And so yeah, that it increases your risk of falls. So why does the fear of falling matter to us? Well, it can stop a person from doing some of their favorite activities that are important to their mental and physical health. Legs weaken with inactivity because we're not doing as much, because we're limiting that, because we're afraid of falling. When we sit, we lose the muscles that we need to use to stand and walk and move. Inactivity leads to falls due to the change in muscle strength and balance and coordination. It may make the person feel alone. If they cut out those activities and those social activities, which can result in depression or anxiety. So there's a link between falls and depression and anxiety.
So we want to talk about what are some of the factors that might contribute to a fall. And there's really three main categories that we look at. The first being physical risk factors. So those are changes in your body that might increase your risk of fall. This could be weakness in the legs. This could be balance deficits. This could be, it's something physical in your body affecting you. The next is a behavioral change. So those are decisions or choices that we make or don't make that might increase your risk of falling. An example of that might be, if you have something on a top shelf in your kitchen and you can't quite reach it, and you pull out the rickety stool that you have, tucked behind the refrigerator. Oh, I'm going to climb on top of this rickety stool, and then you have a fall. That would be, kind of a behavioral. You decided, let's climb this stool. So I would consider that maybe to be a behavioral. And then the other risk factor is environmental. So those are the things that are in our environment, the things that are in our home, on our floors, in our bedrooms, even outside when you're going out, maybe out to check the mail. So those are things that are in our environment that we may be able to affect, that might affect a fall. So then there's factors that we can change, and then there's some factors we can't change, right? So we can't change our age as much as we may try. We're not going to be able to change our age. Can't change the gender and your ethnic background. So those are factors that maybe we're not going to be able to modify. But things that you can change, your physical activity, home environment. And I think what we'll see is not all of these necessarily fall into one of those original three categories. Remember, we're talking physical, behavioral, and environmental. So I think what we wanted to do here was, open it up to the group here and say, okay, where would we classify some of these things that we can change? The physical activity, home environment, vision. How might we classify that? Is it a physical? Is it a behavioral? Or is it an environmental? So at the beginning, we went over kind of how to raise your hand. So if maybe we'll start with the physical activity or inactivity rather, and maybe we can try raising our hands and discussing how does that. Where would you classify that if you had to put it? Is it in 1, 2, maybe is it in all three?
So
put up
Jim,
the three things. Can you put up the three options?
yes.
Yep.
So it's the physical, just like so physical. So about your own body. So whether it's your balance or your vision, or maybe you feel dizzy. Is it environmental, like ice on the path or steps, or is it behavioral? Just, honey, that cord's been there across the walkway for 3 years or for 30 years. I'm not going to change it now, or I'm not going to use my cane when I know I should. So is it physical inactivity? So not doing stuff. What would that be? What would you think that might be?
Looks like Jeff has his hand up. Jeffrey.
Go ahead. Oh, you're on mute, Jeff.
I hit the space bar and it takes me off mute. That's the fast way on a computer to do that. It's not exercising. When I miss my Zoom, in the beginning I wasn't doing much. Then I figured out how to do some Zoom exercises. So it's not exercising at all. Not doing the therapy that the therapist, that the therapist suggested. So that'd be my
Right.
take.
Yeah, I think you're right there, Jeffrey. And so And I would say that's behavioral because you're supposed to exercise. Maybe you went through some therapy and your physical therapist just gave you a home exercise program with exercises, but you're just not following them, and you just you got distracted, or it got underneath the pile of papers, and you're just not doing them. You haven't had time to look for them, and so that leads then to weakness, which is another risk factor. So yeah, I think you're right. Anybody else have a comment on that, or we'll go to home environment maybe. So Jim, I think home environment is, how your home is set up, right? Modifying your home and just like I mentioned, that cord or those throw rugs.
Yeah, and I would agree. So I think home environment probably we would think maybe that would be an environmental risk factor possibly, but I would even argue maybe could be a behavioral element to it as well. If your occupational therapist, your physical therapist says you got to get that carpet rolled up, or maybe tape the edges of that carpet down or get it out of the way, and maybe we don't do those things, that could have a behavioral element. You've decided, not to do that thing. So.
Yeah, thanks. And what about vision? What do people think about vision? Is that a behavioral thing, an environmental thing, or is that about our physical self?
It's physical.
I would agree with you, Connie. Thanks so much. Absolutely. And medication use. What do folks think about medication use? Is that a physical thing? So you taking medication and they might have some side effects. You might have to take them at a certain time of day. Would that be a physical thing, an environmental thing, or a behavioral thing?
It's probably also physical.
I would agree with you too. And I would argue that it's also behavioral, because some people just aren't very consistent. They're not compliant with taking their meds when they're supposed to, right? Oh, I don't need those anymore, or I ran out, I haven't had time, or it's just a bother. So it could be both, but yeah, you're right, Connie, physical. What about fear of falling? What do you guys think about that? Could that be environmental, physical, or behavioral?
Behavioral.
Yep. I agree. And social isolation. So you cut yourself off from others. You don't go bowling anymore, or you don't go for that walk. And out in the park. And you're isolating yourself from others, not because of COVID, but because you're just afraid of even going out there. I think that's probably behavioral too, to a certain extent, right? Because you're just not doing that. So it takes you kind of working through, okay, well, yeah, I'm afraid of falling, so I see that I'm isolating myself. And here's one, and I want to see a lot of hands go up here. What about weakness, physical weakness? Is that environmental, behavioral, or physical?
It's physical.
Yeah. And improper use of assistive devices, like, well, I can think of, Jim, you can speak best to that one. I know that walkers and canes.
Yep. So those are recommendations that I will make for somebody almost every day. That's part of what I do, is looking at how people move and saying, hey, maybe you should consider a walker. Maybe you should consider a cane. We can't make anybody do that. So, if the recommendation might be to, you should use this device. If you decide not to, well, then I would consider that to be, a behavioral risk factor.
Jim, can I just ask you?
Yeah.
In terms of using the assistive devices, it's different in your home, right? I mean, I think if you know your way around your home, it's pretty easy to. Isn't it different when you go other places, or is it? I mean, obviously, you should always be vigilant, but.
Yeah, and a lot. That's a great question, Barb. A lot of times we'll see, or I'll hear, I'll make a recommendation to use a cane, right?
Mhm.
Or use a walker, and I'll hear, well, you know what, I've got furniture that I can, I kind of, hold on to the walls. And usually what I say to that, and Gus, feel free to jump in as well. Usually I say, well, the reason that we want you to, if you need the furniture to steady yourself or the wall to steady yourself, it's probably better to have a cane or a walker, because that's always right on your person, it's right in your hand. Whereas the countertop that you might be surfing to, we call it like furniture surfing, that may not be as close as we want it to be. So, we usually make the recommendation for in-home, and then the recommendation may change when you're exiting the home. So maybe a cane in the home, a walker outside, something like that.
Yeah, I agree, Jim. And so when I go in as the occupational therapist to do evaluations with a new client, sometimes I hear, well, when I ask them, do you use a device for getting around? Sometimes they'll tell me right out, well, when I leave the home for appointments, I have my walker. But when I'm walking around in the home, I'll use my cane, or I'll use use the furniture to hold on to. It depends on how I feel that day, and that tells me they've had some physical therapy, and the PT has worked with them on really recognizing how to being able to tell how their balance is on a given day, and so that's what I go by then. If we go outside in the garden, then yep, we're going to take that walker with us. So that was a great question, and thank you very much. Appreciate that. Did that help?
Sure.
Good. Okay.
No, that's great. Yeah. I work with older people, and I'm just always surprised when they say I'm fine in the house, but they're better when you're taking them to the doctor or something. They're more vigilant. They'll have their walker, but then they get home and they just put it aside. And so
Sure.
that's
And so I think a good question to ask them at that point is, was this a recommendation from a clinician?
Oh, that's good. That's a good question.
Yeah. Yeah. So somewhere along the line, they had some intervention. It could have been outpatient, and they were given that recommendation. And if you think they're unsteady or that's an unsafe practice, then by all means, recommend to them, why don't you get a consult for a physical therapist, and just refine that so that you stay safe, because I want you to be okay.
That's a good idea.
All right. So now we want to talk about, okay, what can you do to prevent falls? So one thing you can do, exercise to improve your balance and strength. So that's, part of what I do with the people that I see every day. We work on implementing exercise programs, and it takes about 50 hours every 6 months to improve your balance. 50 hours right off the bat sounds like a scary number, but when you think about it, it's over the course of, a 6-month period. So it should be something that, hopefully we can incorporate, not too bad, with not too much difficulty. You can also have your doctor review, or your pharmacist review your medications. So sometimes there might be, and Kathleen will probably talk about this in a little bit, but there may be some medications that you might take that may or may not, have put you at a little bit of a higher risk. Checking your vision. This is a very important one. Get your vision checked regularly, as recommended. If you can't see, objects in your path, that's going to affect your balance. So, and then make sure your home is safer. So we'll dive into some of these a little bit further.
And Jim, the Centers for Disease Control and Prevention, the CDC, they have a lot of really good information. And so this brochure, it's called Stay Independent. Just Stay Independent. Anyone can download that from the internet and print it out. And there's a lot of valuable information on there. So if you just write that down, and just take note, and then after this call or at your leisure, do a search, Stay Independent, and you'll be able to find that?
So with some exercise recommendations, the first thing that we always say, you should talk to your doctor before you're starting an exercise program. You want to make sure that from a health standpoint, you're in a position that, you know, any exercise program that you begin is not going to be detrimental. So it's always important to begin the conversation with your doctor. Now you might begin a form of physical therapy or a falls prevention class. You know, like I said, this is something that I work quite a bit with the individuals that I see in their homes, to implement and create safe and, you know, individualized exercise programs to decrease the risk of falls, to improve balance, to improve your overall mobility. And a good place to start with that is starting with your doctor and just saying, hey, you know, I'm feeling maybe, you know, a little bit unsteady or weak. And, you know, the doctor may send something over to, you know, to Waveny or visiting nurse and just say, hey, you know, can you go out and see Mr. or Mrs. Smith for an evaluation, right? If you're doing a class, an exercise class, that's another option. Again, start with your doctor, make sure that they clear you to do that. And you want to make sure that the class that you're choosing is appropriate for your age group and appropriate for your ability level. There's a lot of great classes, you know, that we do virtually now since COVID has taken place. We're maybe not doing so many things in person, although hopefully that changes. Hopefully that changes pretty soon. So you want to find something that you can incorporate into your day-to-day routine. Now, whether it's with a physical therapist or occupational therapist in your home, or whether it's an exercise class, really, you just want to make sure that you're starting to some type of movement that you can easily put into your just day-to-day. And it's important that you stick with it. That's the biggest thing, is when you start it, you know, you want to make sure that you're trying to follow through and carry it through, because that, going back to what we said before, it's about 50 hours every 6 months to improve your balance. So that takes a little bit of commitment. All right. So now I want to talk a little bit more specifically about some of those environmental risk factors that we talked about, some environmental hazards. And when I walk into somebody's house for the first time and I'm assessing the home for safety, one of the very first things I do is I look at the floors. You know, there can be a lot of things on the floors, and I'm sure Kathleen and Gus can back me up on that. There's a lot of things that might be on the floor. So I look at furniture. Is the furniture arranged in such a way that maybe it's making a narrow walkway and you have to kind of squeeze sideways to get through? That would be a potential fall hazard, right? Throw rugs. Throw rugs are one of the things that I talk about almost daily, because everybody has them in their homes. They're nice, they tie the room together, but a lot of times throw rugs, they get a little loosey-goosey around the corners, and you know, it might be something that we can trip on. Newspapers, magazines, books, shoes, towels, you know, anything that's on the floor, we want to try to get those up. Electric cords, Gus was talking about electric cords and wires. So when we're walking, we don't have a whole lot of clearance when we walk. It's only about a fraction of an inch that our toes clear the floor anyway. When there's nothing on the ground, that's just a regular level surface. So if we have anything on the ground and that takes up some of that space, it's going to pose a potential tripping hazard. Other things that I'll look at, the steps, stairs and steps. So I am guilty of this. I put things on the steps to go up so that I don't take them up, you know, right away. I say, okay, Jim, you'll do it tonight when you're going to bed. But that is something that you could trip on. So you want to make sure that the stairs are always clean. You don't have anything on there just waiting to go up or just, you know, sitting there. I also look at the steps themselves. Are they broken? Are they uneven? A lot of times I'll see in some older homes that maybe the steps are really narrow, and, you know, I go to step on it and maybe the back of my heel's hanging off the edge, my whole foot isn't making it on. So those are some considerations. So you want to look at your stairs. Lighting, over the stairway. That's also important too, is maybe the light burned out. Is there not a light at all? Those are things that you can consider. Also, the light switch that controls that light, is there maybe only a light switch on one end? Is it upstairs or downstairs? It might be worth having somebody come in to fix the light that's over the steps, or install a light that's over the steps, or put that light switch on the top and the bottom so that you don't have to potentially climb a whole flight of steps just to turn the light on. Hand railings is another thing. A lot of us will have hand railings maybe only on one side. Is it possible to put another one in so that you have two handholds? That might be something to consider as well. Carpeting too, that tends to get frayed. It can that can also be an environmental fall hazard as well.
And Jim, I just want to add that the lights and burned out lights, that's a really big one, because I know Kathleen will talk about vision a little bit more, but did you know that as you get older, so by the time you're 65, those rods that you use, because in our eyes we have rods and cones, and the cones are for color and the rods are for night vision. By the time we're 65, we've lost about 40% of the rods that we had when we were in our 20s. And so that means that we need more light when we're 65 to be able to see what we saw when we were 20. And when I work with people, a lot of time, the hallways are so dark, and the light might be burnt out, and it's dark, and you just can't see where you're going. So that's a big one for me. Yep. And the throw rugs, just like you said too. I just had a client that she was so attached to this throw rug. It was a family heirloom. No, I'm not moving it. And it was clearly, it was sliding all over the place. And so the family, the kids were dynamic and intuitive enough. They took that rug and had it framed, and now it's got this prominent place on the wall. So she can always see it, and there it is. And now it's safe to walk across that area. So
Gus always say that it's always been there. I'm fine with it.
Yep, absolutely.
But there's that one day it's not fine.
Absolutely.
Absolutely. Yep. That's such a creative idea, though, to take a carpet that you love and put it up on the wall, so you're not losing it. It's still there. And I would even argue that maybe it's even more of a conversation piece now. Now it's not on the ground. Everybody can see it.
Yeah, they had it cleaned and it looks brand new, like the day they bought it.
Wow. So some other things that I'll look at when we go into the home: kitchens, bedrooms, and bathrooms. So in the kitchen, I look at things that may be on high shelving or low shelving, and I recommend that people bring it up. At the beginning of the presentation, the example I had used was, that cup that's way up on that top shelf, and I'm climbing on that rickety stool to try to get that, and then possibly have a fall. A good alternative or good solution to that would be maybe bring those objects down. Bring that cup that you have on that high shelf, bring it lower, so the utensils and the plates and things that are used heavily are easily accessible. And you can do that with maybe pots and pans too that you have on low shelving. Maybe you can bring those up, things that you use regularly. Step stools, like we said, step stools, some are okay, some are a little bit scary. So they do have some of the step stools that have the handles, some have really wide bases. So there are some ways to kind of work around step stools, but I think the best thing you can probably do is try to bring the objects down, bring them to a level that you can access. In the bedroom, where's the night light? If a lot of us get up in the middle of the night to use the bathroom, and I know personally, I like to sleep in the pitch black, and when I wake up, you can't see anything. So it's really important that you have a night light on, either in the hallway, kind of illuminating where you go, or a light switch that you can very easily and readily access. So you can, the second you wake up, you can turn that light on. Other cool things that I've seen recently, I always think back to, the clapper, that commercial clap on, clap off. I don't see those in homes too much now, but if you have one, great, use it. You know, that's clap your hands, your lights are on. There are some cool, there's some cool technology now with smart light switches where you can say, and I don't want to say it too loud because there's probably a few of you that have it, but hey, Alexa, turn on my lights. Hopefully I didn't just trigger a bunch of a bunch of Alexas in the homes, but there is some technology like that where you can say, hey, Alexa, Siri, turn on my lights. And that way, right away, your lights are on. We also look at the height of the mattress. Really low mattresses are hard to get out of. Really high mattresses are also hard to get in and get out of. And making sure that the walkway to your bathroom is well lit. Inside of the bathroom, the tub in the shower, is it a slippery surface? Is it a tub versus a shower? Those are some things that we'll look at in figuring out, okay, where can we maybe put some railings? Can we put railings in the bathroom or in the shower stall, the tub? Can we put some railings by the toilet to make it a little easier for you to get on and off of and, climb into the shower and out of the shower? One of the conversations I have with a lot of people is, well, what type of railing should I use? What are your thoughts, Gus, on the suction cup grab bars?
Well, I actually have one I was going to show everyone, but I think people know what we're talking about. So it's these grab bars that you can buy them at Walmart or Lowe's or Home Depot, and you put them on an area in the tub, and then you lock them down, and then they create a grab bar. And so if you can't necessarily, if you don't want to mount something really sturdy that's screwed into the actual beams in the wall, then that's what it's meant for, is to be. I just don't like them, Jim. And I'll tell you why, because they do come loose. Some of the newer ones have a little light that's either green or red at either suction, and if that suction isn't there, then it'll be red. But if you do have them, or if you see people that have them, I always make the recommendation, it's a good idea to have a grab bar in here. Let's talk about maybe mounting something more permanent, because they wear out. That suction wears out with time, and you can't depend on them.
Yeah, I would tend to agree with that, especially if you have any type of tiled, shower stall or textured, it's just not going to give you the support that you think that it may be giving you. So
100%. Yeah.
Always recommend, whenever possible, get a contractor, have a professional come in and install a sturdy grab bar, and not a towel rack. A towel rack isn't a grab bar. Towel racks are meant to hold up the towels, but not us. So always consider having that professionally installed.
And it's important. This is a good time to mention too that any OT or PT or even nurses who have worked with us a lot, they can identify, yep, you should have a home inspection and a safety inspection, and maybe get some recommendations. And both of our agencies, both Visiting Nurse and Hospice of Fairfield County and Waveny Home, we have clinicians who are especially trained for making home modification recommendations. So we went to school to actually learn about that, and took it's a week-long course. So we're very well equipped to give you that information. And I wanted to talk really quick before we go to the next slide about those night lights, and I really like them. And there is a nightlight that I found that I've made recommendations for a couple of times. It has a motion sensor. So
I have that.
You have it?
Yeah.
Oh, they're so great, right? Well, Kathy, so you tell us about it.
I step out the door as if I'm going to walk down the hallway, and the thing goes on very brightly. It takes a few minutes to go back down, but it's fabulous. You don't have to think about it. It just works every time.
And you don't have to think, right? And so, Kathleen, you've made your environment safer by having that light there.
Yes. Yep.
So an important thing that each of you can do to reduce your falls risk is to identify and eliminate those fall hazards in your home. To start the process yourself, there's a helpful brochure, and here's another brochure from the CDC. And if you want to write this down, it's called Check for Safety. Check for Safety. And there's lots of hazard checklists. I know the AARP has a few, and they're available, and they generally guide you through your home from room to room and help you identify potential hazards like this CDC brochure. And some also make recommendations to fix the hazard. For instance, you might be asked in the checklist, do you have throw rugs on the floor? And then the recommendation will be, it's an algorithm, remove the rugs, or double-sided tape, or non-slip backing so the rugs won't slip. But the best, and if you want a real professional opinion, of course, is to ask one of us to come and take a look.
Hey Gus, how does that get paid for?
What's that?
Those services?
So that's a good question. So if you're questioning that and you're at risk and you feel you're at risk for a fall, talk to your doctor and go in, because if you're having these questions, then maybe something's going on, and that doctor then could make a referral to one of our home care agencies or anyone, and we can come in and we can start that process. And if you're 65 and Medicare eligible, then Medicare will cover that.
Mm-hmm. Okay. Well, I guess I'm up. I guess we established earlier that medications can definitely affect your risk for falls. And it is one of the things you can affect a change in. Heightened awareness of what medications you're on that increase your risk for falls can really be a great benefit in the long run. 50% of adults who are over 65 are on 4 or more medications. That's officially in our criteria in the home care world. One of the risks, you suddenly become a risk for falls just based on that criteria. Medications are prescribed for a reason, right? They're prescribed to manage a symptom, but many times we are put on something maybe in our 40s, like a blood pressure medication or a diabetic medication. And the doctor sees you every year and you stay on that same level of medication when now you're older and you're metabolizing your medications differently and things are changing. So this is something that should be looked at annually with your physician. And physicians don't always volunteer to take a look at this. They need reminders. They need to be asked to do a review of your medications. And it's also important that anytime you're on any new medication, that you really try to be extra aware of how you're feeling, what side effects you might be experiencing. If you had home care in, a home care nurse would monitor you for 2 weeks anytime a medication is started for the very first time. Let's talk about some types of medication just briefly. I'm going to talk about 3 types: the types of medication that affect your brain, the types of medication that affect your blood pressure, and the types of medication that affect your blood sugar. What do the medications that affect your brain include? Some are benzodiazepines, such as, I'm just going to give you a few examples. This doesn't cover all, such as Xanax and Ativan. Those are taken for people who might have anxiety or to get some help with sleep. Non-benzodiazepine medications for insomnia are Ambien, Lunesta. What do? What is the problem with those medications? Well, they can impair your balance and they can increase confusion. And in addition, they do increase the risk for dementia. Another medication that affects the brain is an antipsychotic. And why would these be used? Well, these would be used in patients who might be having behaviors from dementia. And some of the ones in particular that we watch very closely are medications like Seroquel and Zyprexa and Abilify. And these are just a few examples. What do these do to increase the risk of falls? Well, sometimes there's association with what we call syncope, a fainting spell, sedation, and slow reflexes. Another medication that affects the brain are anti-seizure medications such as Depakote and gabapentin. And a lot of times these aren't just used for anti-seizure. Sometimes these medications are used to alleviate nerve pain. So you always have to look at all the medications you're taking and really take a look at what they're doing in conjunction with each other, especially because these anti-seizure medications can cause dizziness and a slow reactive response. Antidepressants are another medication that affect the brain, such as Zoloft, Lexapro, Paxil. Those are the highest degree of fall risk in this category. I think we've all heard a lot about opioids lately and people getting addicted to them, but they are a narcotic pain reliever and they do cause drowsiness. So anytime we're drowsy, we're not going to be as effective in functioning. Anticholinergics is one of the last ones we'll talk about for the brain medications, and that is something that they block a neurotransmitter called acetylcholine. And some of the ones that affect us the most are over-the-counter ones, so such as Tylenol PM or Benadryl. Benadryl is also something that people over 65 often use for sleep, but it does increase confusion in the elderly, so it should not really be used too often. Or any medications that are muscle relaxants or medications for vertigo, because they do relax you. So anytime you're relaxed, you're not going to be quite as sharp and functioning as well as you usually do. The second type of medication I'll talk to you about is medications that affect blood pressure. And that's probably the one that we see the most as nurses in the field. Again, you'll see someone put on something, for example, called metoprolol. And you'll see someone put on it at one stage in their life and they're still on the same dose. Well, maybe their blood pressure is controlled now. Maybe they don't need as much. And just because you've taken a medication for a very long time does not mean you can't start to have a different reaction to it with time and with age. Another medication for blood pressure is Lasix is sometimes used to help blood pressure, to help congestive heart failure. Lasix is a diuretic. And anytime you have a diuretic, you can have a sudden drop in blood pressure. So what's that going to do? It's going to cause dizziness and a risk for falls. So we always worry about hypotension with any of these medications. The other medications that I'm going to talk to you about are the medications for blood sugar. And again, diabetes is a very common ailment in many of us in the United States. The diabetic medications, for example, could be metformin, glucophage. You might have an injectable diabetic medication, insulin. So it's really important when you are on these medications to monitor your blood sugar exactly as the doctor has asked you to do. That is one way you can prevent a problem. Be aware of your hypoglycemic and hyperglycemic reactions and signs and symptoms. So if your blood sugar is too low, you might have hunger, irritability, trouble concentrating, and confusion. Again, you're going to be at risk for a fall. If your blood sugar is too high, you could have some weakness, blurred vision, like we talked about vision changes before. Anything that causes distress is going to increase your risk for falls. We also want to consider over-the-counter medications, herbal supplements, because they can so many times potentiate, which means to increase the effect of a medication. So if you're on a blood thinner, for example, and you're taking like a garlic pill or something like that, that can increase or potentiate. So always try to talk to your pharmacist and your doctor and let them know exactly what you're taking, every single thing, every supplement. The CDC has 3 recommendations, and there is a brochure that is called Medications Linked to Falls that you can look up for the CDC. And the CDC's recommendation is to stop medications when possible, to switch to a safer alternative, and to reduce meds to the lowest effective dose. So I think we have the next slide. We're going to actually concentrate a little bit more on blood pressure. So there's other things related to blood pressure that don't have something to do necessarily with medications, and that's called orthostatic hypotension. And that's something where when you go from laying down to sitting up and you stand up too quickly, you might feel very dizzy. Well, that's because some people have a sudden drop in blood pressure. So for those patients, what we usually recommend is you take each step slowly and you give yourself time in between. So if you're laying down, you sit up, you wait a few seconds, you do some breathing. Next, you put your legs over on the side of the bed and you wait just a few minutes. Then you stand up. What are some of the things we can do to be extra careful if we have orthostatic hypotension is to learn how to take your own blood pressure. Go to the pharmacy, get a blood pressure cuff. If you do have home care nurses involved in your life, they'd be happy to teach you. Any therapist would be happy to teach you at any time. Everyone is well-trained in this area. And again, that very last line, be careful after beginning any new medication because it will affect all of these things and your reactions. To the next slide, I think. All right, so we're talking about vision. Like they mentioned earlier, our good therapists here, we should have an annual eye exam after 50. And also after 50, you suddenly notice some changes. So you might be only used to having one sort of a visual defect, and suddenly you have distance and you have close range visual defects. And we all start wearing these multifocal lenses or progressives. And if you're really not used to those can be quite a challenge and really can make things very difficult. So it is recommended here that you use separate reading glasses until you get used to that. Now, this is my favorite, removing cataracts. When you have cataracts, you will notice that you have a halo around any of the lights you see. So if you are negotiating your way down a staircase and there's lights, these halos can be quite distracting. They can be quite difficult. So don't wait too long to get cataract surgery because it does really change things and your vision is almost newly restored. So if you're going to have cataract surgery, do it as soon as the doctor says that you can, because it really will enhance your safety and enhance your life. I think, any questions about that?
Kathleen, I just wanted to mention that a conversation that you and I had earlier about masks
Oh, yeah.
and glasses.
Yeah.
My glasses are constantly fogging up when I'm wearing a mask, and that reduces my vision.
Right. I'll be the first to say if I'm going down a staircase, and we wear masks all day long where we are at work. So if I'm going down a staircase and I have that mask on, boy, that's the one time I do have to just let it hang off my ear for a minute just to be safe to get down those stairs, as long as I'm not near anybody. Okay,
so all chronic conditions can impact fall risk in many ways. Diabetes might change the sensation in your feet. That's called peripheral neuropathy. Arthritis can cause pain that may make you walk abnormally. Stroke may cause weakness in one side of your body or change your perception of the environment. Multiple sclerosis, Parkinson's disease, and other neurological disorders may affect balance and mobility and increase fall risk. Chronic pain might cause you to stand in a stoop posture or cause muscle weakness, which can result in fall risk. Depression and the medications for depression can both cause fall risk. Chronic obstructive pulmonary disease, COPD, or anything that changes your lungs capacity can also cause fall risk. Making you dizzy when you move from sitting to standing and also losing oxygen to your brain as you become active. Be careful and speak to your provider about using oxygen during an increase in physical activity.
So some factors that may result in your risk of falling increasing. So Kathleen just talked quite a bit about the medications and had mentioned that, if you have a recent change in medication, depending on some of the other medications that you may be taking, that might affect how you're feeling, that might affect blood pressure. So anytime you start a new medication, that's when you want to kind of be aware of that. Any illness or infection that may result in weakness or deconditioning, that could put us at a higher risk of falling. Pain, of course, if we have pain, a lot of times our bodies try to figure out ways to put us out of that pain, by maybe developing a new way of walking, a limp or a lean to try to avoid that pain. But that might shift our center of gravity off a little bit and put us at a higher risk of falling. Lack of sleep, if you're tired or you didn't get a good night of sleep for whatever reason, again, could put you at a higher risk.
Could I make a suggestion?
Yeah.
In my own personal experience, there's something that is of greater risk than all of these put together. And it's constant and it's everywhere. And it is my not lifting my feet up properly as I walk.
Mhm.
A lot of that is due to the fact that I've got arthritis in my feet from an old ski injury.
Mhm.
But I find that you've got to, no matter who you are, you've got to be extremely alert.
Mhm.
For example, we moved into an apartment complex. Very, very nice. They have a fully manned concierge desk. They have a swimming pool and things of that sort. Elevators. The elevators have a black rubber mat inside, and immediately outside the door, they have a similar rubber mat. And it's about, I'd say about 3 feet by 5 feet. I've tripped on one or the other of those mats about 5 times in the three years we've been there. And it's simply a miracle that I haven't destroyed my knees or hips, because I'm falling on a concrete. The elevator goes to the garage, and I talked to the management, and we've gotten rid of the carpet in the elevator, but not in the open area beyond the elevator. You cannot avoid it. It's something that these mats all eventually, after a certain period of wearing, they start curling around the edges.
Mhm.
They curl up, and the curls can be as much as an inch high. And you have to lift your foot very high to get above that. So far, my concentration is not particularly great. But when I am concentrating, I've been lucky, and I haven't had it lately. But
Oh, you're muted.
You muted yourself, sir. But I think you bring up a really important point of being an advocate, right?
Yeah.
And so if you live in a complex with other people, and you notice, or even at a store or someplace out in the community, if you notice something that's unsafe, then speak up and let people know, because the management might have the best intentions, and they just might not think about something in it, and they're relying on people to point things out. And so I think that if you, just like you did, that change occurred after you mentioned it. I think
but you have to do it not just once.
Yeah. gotta keep
Because management changes here in our place about every 6 months.
Yeah.
So you got to go through a whole re-education process.
You have to be
every 6
persistent.
months.
Absolutely.
You got to be the squeaky wheel, right? That's the one that gets the
You
oil.
do, which is, it's really not a happy role to play, but necessary.
Well, I'm glad to hear that you're okay after taking those falls, but I think that does kind of highlight a couple, there's, the environmental risk factor, right, of the frayed, padding, and then in combination, like you had mentioned, the trouble lifting the feet up. So, that's a 1-2 combination, but I'm glad to hear you're doing okay, and good on you for, like Gus said, advocating for yourself and all of your neighbors in that complex. Very good.
So we're 3 past 8 o'clock. So we're a little past the top of the hour. And I know we're going to be competing with our president. So we have 2 slides left. So we're in good shape right now. And so there are many things you can do to prevent small falls, but you need to start small, right? So if you choose one risk factor at a time to address, contact a health professional who can help you address it. If, for example, you could contact your pharmacist or doctor and review your medication, just like Kathleen said. Look at the side effects that may cause your fall. There may be alternative medications that work for you. And for goodness sake, if you, and this happens, I come across this often, some people have multiple pharmacies and they might not talk to each other because they might have a cardiologist that sends a medication to one place, and you've always done that for the past 20 years. And then your primary care physician sends stuff to another place. And they might not necessarily know. So choose one pharmacy, because your pharmacist, as soon as your profile is loaded onto their screen, just like ours in home care, it shows all the drug interactions and what side effects they could have.
And Gus, I just want to add that we don't ever want anyone to abruptly stop a medication. We always want the doctor to be involved and taper anything down. We don't ever want someone to take that upon themselves, because they could have a very bad situation on their hands.
That's a really good point.
Mm-hmm.
And also, so an occupational therapist can do a home assessment and give you ideas to make your home safer, to help decrease your risk of falling. And a physical therapist like Jim can teach you how to use your cane or walker at the proper height, and help with balance and strength and your ability to walk safely.
So if a fall does occur, one of the first things you want to do is quickly try to assess, check yourself out, and check for injury. If you're injured, you want to try to call for help if needed, and get the medical attention that you might need, especially if you are injured. If you had a fall and you're recovering from that, it's always good to follow up with your doctor and say, hey, I've recently had a fall, and I know that now that I've had one fall, I'm at, a higher risk of having another one, but I want to get in front of this. Call your doctor, and they can always refer you to one of our home care agencies, and we'd be happy to stop out and do some of the things that we talked about today. Check for some safety hazards in the home. And one of the things that we can do as physical therapists is we do work on teaching you how to get up safely. If you have had a fall, there are some strategies that you can implement to safely do that. And that's one of the things that we can do together. But always want to make sure that if you have had a fall, that you are following up with the doctor, so that we can work together to prevent another one from happening.
Could I ask a question?
Sure.
It just occurred to me that in a building like ours, and a lot of my friends are in similar facilities, it's very common to have concrete floors everywhere.
Mm-hmm.
Like I was surprised recently where I fell in my apartment, and it's a sponge-like surface, but underneath it, it's clearly concrete. It's not wood. And no one is ever warned about concrete surfaces and the risks that are involved. Is there any legislation involved that exists that would require that pedestrian passageways, particularly for elderly people, the surfaces of the walkways should be meet certain requirements? Because just the existence of a concrete surface is a high risk.
Yes, so there is some legislation, and one of them that comes right to mind is the Americans with Disability Act. And so from the federal government, there are guidelines, and it's because of that we have on the sidewalks we have the slopes and the angle, so that's not a step there. We have the lights that tell you when to walk, and also the sound. So there are regulations for entrance ways, common areas, and things like that. And I think what you were talking about in terms of flooring was the laminate. And so the laminate, it's I happen to like it, and from universal design, which means that the home is safe for all ages. From that perspective, I really like it because it's a flat level surface, and underneath that laminate is a really thin layer of foam, and so that's usually how it's put down. And so it's good for a couple of reasons. And one, you heard us mention some of the neurological disorders like multiple sclerosis and Parkinson's. People with Parkinson's disease, they have a hard time going over thresholds, and even a line, like a different design on a carpet, that could make that person freeze. If you're using a rolling walker, or if you're in a wheelchair, getting over those lips. And Jim and I had a conversation about thresholds the other day. Some of them, from if your house was built in the 50s, use those marble thresholds going into the bathroom, and the doorways are really narrow. Those are just absolutely impossible to get over. So the flat layout of the floor is something that is new, and I think I think it's a real step in the right direction. So I would say embrace that, because if you ever have to use a device for getting around, it's going to make it a lot easier for you. What do you say, Jim?
Yeah, I would tend to agree with that. And you know, when thinking back to the saddles, and a thing that you can do if you do have those saddles, those thresholds in the home, you can always, when you've got your contractor out installing the grab bars in the bathroom, you can have them take a look at that, because that's something you could potentially trip up on, and they may be able to remove it. Now, I don't know, I think you had asked about specific, legislation on concrete floor. I mean, I know, like Gus had said, the ADA, but I don't know specifically about the concrete flooring, but yeah. Did that answer that?
So
something somebody ought to take up.
Yeah, you're right. And so and you bring out something. I'm going to research that. And do we have your email?
I'm sure it's in there somewhere.
Yeah, so we'll do a search, and we'll get back to you on that, because that's a really good question. I'd like to know that. I'd like to find out more about that. So
I'd like to follow up as well. I'm a lawyer, by the way, so.
Oh, are you?
I
like lawyers.
Actually, I really like lawyers. I addressed a bar association meeting in which I kind of embarrassed everybody by saying how much I liked lawyers, because they're not used to hearing that.
Oh my gosh. So it's 13 past 8 o'clock. I think what we can do now, Kathleen and Jim, if you guys are in agreement, is there's a couple of other things that we can talk about. We can talk about just some exercise classes that are available online right now because of COVID. But if you want to switch over to the president, then by all means do that. In terms of the real bulk of the information, we've shared that with you now. And just be aware that there are some programs out there like yoga and Tai Chi. And we'll talk a little bit more about that in detail just in a minute or so, but we'll give
Forgive
a
me
chance
for
now.
bowing out. Thank
Yeah,
you.
no, we'll give a chance. We'll make it a nice, easy, smooth goodbye. And so for those of you who are going to sign off, I just want to thank you on behalf of Waveny and the Visiting Nurse Service of Hospice of Fairfield County. Thank you very much for being on tonight. And I hope this was
Thank you.
informative. I hope you learned something. I always, it's these information sessions, they're meant for you to be able to pick up something. There's at least one takeaway, and I hope that we did that for you tonight.
Thanks again.
And Jill, she's got her thumbs up. Thanks so much, Jill.
Thank you very much. It was excellent.
Good. Yep, very appreciative.
I'll go watch the president now.
Okay, yeah, go watch the president. So like I said, if you want to stay on a couple of more minutes, then stay on. This is a good time to bail out if you want to. I know that's important too. Okay, so I'm thinking that that the people who are still on want to chat a little bit. I'm gonna just advance a couple of slides here to this slide here. And we already talked about what the different disciplines can do for you, but I think it might be a good idea just really briefly for us as disciplines. We're all a team together. And we work together, so as a team, but we all have kind of our focus and the expertise that we bring to the table. So in terms of physical therapy, Jim, what would you say and that really jumps out at you as from a fall prevention perspective?
Yeah, so I mentioned a little bit, one of the things that I look at quite frequently with many of the people that I work with is an appropriate assistive device, whether that be a cane, a walker, a hemi walker, crutches. We work quite a bit on figuring out what is the most appropriate device for you, making that recommendation, sizing you for it, figuring out how to acquire that device, and making sure that you're comfortable with using it in your home and in your environment. The other thing that we do a lot is, focusing on figuring out, okay, well, what are some of your maybe physical risk factors? Is it weakness? Is it balance? And, creating an exercise program, something that you can do on the days that you're not working with the physical therapist, to continue to work on improving your strength, improving your balance, and then practicing specific functional tasks. Is getting in and out of bed the thing that's really challenging for you? Up and down steps, is that what causes the most difficulty? Walking, so we focus quite a bit on that. And I imagine Gus and I probably have there might be a little bit of overlap in the things that we focus on, but that's what I hit quite a bit. So again, it's the assisted devices, a home exercise program, strengthening balance training, and then functional tasks like getting out of chairs and walking.
Can I say something?
Absolutely.
One of the things you keep talking about walkers, one of the things that my physical therapist about a year ago said she couldn't do anything more for me because my back was so bad. I have very bad scoliosis or whatever.
Mhm.
And, but she showed me, and we went and bought a 3-wheel walker.
Hmm.
And that has been marvelous.
Oh, good.
And we keep one in the car and one in the home. And that is, I can get around the house just beautifully with it. And it's made the biggest difference in the world. I don't need the full walker yet.
Yeah.
But it's just made. And it's so small and it doesn't weigh very much.
Yeah. Well, that's a terrific story, and it really, I think, highlights that, when you do work with your therapist, it typically there is it's a finite amount of time sometimes that we're working together, but we want to make sure that we're, leaving a lasting impact when we do say goodbye. And it sounds like
Well, I've just gone back to the therapist.
Oh, good.
And my daughter tells me that she notices a huge difference in that I'm able to pick up my leg better.
Oh.
And she just notices the difference in my walking and things.
Mhm.
And I'm back to doing exercises in the morning at home.
Oh, that's great. That's such a wonderful story, and
Yes.
I'm so glad that you're working with your therapist again and
Yeah.
improving.
I've worked with her for years, and now I used to be able to go around the gym with her several times. Now I can just barely make it one time
Mhm.
after she's been doing stuff with me. But she was able to pull out my leg or something, and it made the hugest difference.
Wow.
Just one thing. And my daughter noticed that I picked up my foot much better than I had. So thank you so much.
Wow, Louise, thank you for that wonderful story. That's amazing, and that's what it's really about, right? Is just interaction, and we learned from you too. So I appreciate that tremendously. Kathleen, would you mind summarizing what the nursing role is when it comes to fall prevention?
Well, nursing role, like we talked about, is to monitor your medications, review your medications, ask your pharmacist as well as your physician to look at them, be aware of how you're feeling when you start new medications. And again, don't discontinue them without your doctor's consent and approval.
Thank you. And me as an occupational therapist, so I always tell my patients, because they'll ask me, what's the difference between a physical therapist and an occupational therapist? Or I already have a therapist, I don't need you. So I tell them, well, you know what? So yep, you're right. You have a therapist, and that's a physical therapist. And the physical therapist is going to get you walking and is going to make your legs strong and make you safe with your balance. And I'm the guy who's going to get you doing things again. So going to make sure that you're safe in doing, I might modify the way you do them. I might modify the activity a little bit. I might have you use a special device. Like we have gadgets like reachers or button hooks or a dressing stick or a long handled shoehorn. Or I might suggest that you modify your environment so that your environment it fits you, right? Because we want you to fit your environment and vice versa, so that there's a good fit and that you stay safe. So that's kind of how I distinguish. And so here's yoga and chair yoga.
Yeah, so there's some great online resources as far as yoga goes. We have a link down at the bottom there, Yoga Anytime. They have some options for chair yoga classes. So what does it really do? It helps to reduce your stress, lessens your risk of depression, which Remember, we talked about how that may be, a risk factor. And then it enhances your balance, your flexibility, your mobility, your strength. That's what we've been talking about. That's what we've been focusing on, tonight. So it really kind of helps make sure that you're checking all those physical boxes to limit your risk of falling. I know I mean, after I do a yoga class, I feel great. I mean, it's great to sit and participate in that. And we always, like we've been
Can I
saying,
point something out, Jim, that the VNH is offering a free yoga class on April 5th at 2 p.m. It is open to everyone, and I can send some information about that to all of you folks. And it'll actually be happening every other month. They'll be alternating regular yoga with chair yoga. And those are all, like I said, they're free, they're open to the public, and those are going to be hosted by the VNH. So it's be a great way to try out some yoga without any commitment or any cost to you. So we'll certainly be letting you know more about those dates and times as we get a little bit closer.
Oh, that's great. That's great.
that's a great resource. Great.
And there's also Tai Chi and Tai Chi Quan. Jim, you want to just talk about that real quick?
Yeah, so it's similar to yoga, but it's focused on fitness and balance. There is another course that is a little bit of a progression stepping on. With this, there's not as much of an educational component to it, so it's really focused on the movements. And the classes are, ongoing. They're not limited to certain weeks. You can kind of hop in and go kind of at your leisure. There is a requirement with these classes. They typically want to make sure that you're able to stand on one leg for 3 to 5 seconds. So now, before you try doing that, I would make sure that you're with a therapist, with a physical occupational therapist, that you're supervised while you're doing that, so that we know that you can do that safely. But this would be another great program for a lot of individuals to explore. And again, with all of these classes, we want to make sure that before you embark on them, you're having that conversation with your doctor to make sure that it is an appropriate decision.
So here's just some really quick resources that you can do a search on. And if you remember at the beginning, I said that the commissioner has really made it a priority to prevent falls and prevent accidental injury. And so there's a whole task force that and a fall coalition within the state of Connecticut. And there's if you go to the Department of Public Health in Connecticut and you put in falls prevention, you'll get a lot of really good information. And there's some Tai Chi classes that they have on occasion that you can zoom into. And I think they do them up north someplace in Pomfret or someplace up there, but you don't have to travel up there. You can just zoom right in. So that's a really good thing. The local senior centers are a great resource, and I've actually done some fall prevention classes at some of the senior centers, and they have ongoing programming, and I know that it's limited now because of COVID. So just maybe check on the website and check with them. I know that the Jewish Center in Stamford, they have stuff on occasion. Check with your hospital and health clinics, and of course, stay tuned to our websites at Visiting Nurse and Hospice and Waveny, because like Heather pointed out, we've got programming too, and that's great. And the YMCA. And the bottom line is, if you move more, your body will be stronger and fitter and have a decreased fall risk. So find something that you enjoy that's beneficial and go for it. So move more and be safe. I like that logo. Move more and be safe. And questions, discussion. I see Lorraine came on. Hi, Lorraine.
Hey, Lorraine.
Okay. And hi, Kathy. Do you have any questions? Okay, well, I'll go to the very last slide. Thanks for coming. Thanks for being here with us tonight.
Thank you, everybody.
Thank you, Gus. Thank you, Jim and Kathleen. It was a great evening and we enjoyed having everyone.
Thanks very much. Love being part of this team.
Yep.
Thanks so much. Yeah, that's great.
Have
Thanks.
a good night, everyone.
Stay
night.
safe.
Night.
Yep. Good night now. Bye.